Sitting next to my buddy Larry Trillips, and he goes, Phyllis Fryer after lunch. Oh my God. He didn't want me to be the speaker after lunch. Why is that, Larry? Would you care to come up here and explain yourself? Or maybe we'll talk later. Okay, we'll talk later. All right, are we ready to go?
There is no higher calling than supporting the well-being of another person,
of a community, of an entire region.
This is as good as it gets.
This is who we are and why we are here.
We are the way back to health and home, family and life.
And this is our time
to turn others into believers.
We are believers.
In ourselves, our partners, and the vital importance of our mission.
We exist to make a genuine and lasting difference in the health of the people and the communities we serve.
And in this mission, we hope to inspire others.
Together, we can be everything that is good, right, and human in healthcare.
This is when we live up to our name.
This is when we become renowned.
Okay, that was much better. You guys like that? So when we were preparing, do we have the, there we go. When we were preparing for the communication rollout for our new strategic plan, we determined the obvious and that there is no more important audience than our own employees. It is not just about communicating our new vision, mission, and values. We want people to embody it, to embrace it. And so we've provided you a toolkit, and we're going to go through the toolkit today, and then you can absolutely let me or my team members know what else would be helpful to you in terms of inspiring and engaging your employees, because we've got a great new vision and mission, right? We're very excited about that. I heard great things in the breakout session, and now we're the folks that are going to take this forward. So that's what we're going to talk about here, and I'm going to talk a little bit about the toolkit you have in front of you. Okay, so the video that you just saw, that's, I think it's only 1.5 minutes, very short and easy. It's going to be on the, available to you so you can show it at department meetings. We really think this is a good start to talking to your employees about everything we've been doing. I wanted to tell you a little bit about the new look and feel. Totally different, right? The other thing we decided, it's totally different direction for our organization, building on the solid foundation that we already had in place, but we really thought it was important to have a new look and feel. And if you don't think a pink Tahoe Tower and light bulbs with wings is new for us, it's definitely new, right? We haven't done anything like that in the past. But we used someone I'll tell you about in a minute, a local illustrator to help us with this. And this is all specifically for Renown. You can see the words here, partners, community, innovation, with our partners. All these are words you've been hearing about this morning. My hospital, with our partners again. I love the little arm in arm. Make a genuine difference for your patients, for your community. I was thinking earlier when Tony was presenting, the little skyline didn't really make sense because you didn't have all the materials yet in front of you, but all of it I hope will come together here after we're done with this little session. People, communities, well-being, health, manage population health, build relationships, grow our scale and scope. So these are more than pretty pictures in your book. These are about reinforcing the messaging that we want you to share with your employees. This is one of my personal favorites. I love the little eye patch on the dog, but you've got the renown within the communities below, and this one's actually cut off, but up above are some trees and people biking. So these were made as embodiments of where we're headed. Of course, these are our values. And Milan Spurka, did I say that right, Lisa? Milan Spurka. He's done other things around in the community, local, really terrific. Okay, so one of the fun foundational pieces that you have to share with your employees is something we call the Purple Playbook. And if you don't get it right away, it's like a playbook for a team. We're a team, and this is our Purple Playbook. And just for fun, when you're rolling things out, you have a purple chalkboard, because that's what that is. That's a chalkboard thing. So you have a purple chalkboard, and you can take one of the pens on your table, and you can stick this to a wall and then unstick it later, and it's fabulous. Anyway, that's just a little fun thing as you're rolling this out to your team. But I wanted to walk you through this Purple Playbook. It is a foundational element. We wanted it to be a takeaway for employees, so they have something to put on their desk or put in their pockets, or if they're people in uniforms, maybe they have a locker, whatever it may be. We wanted it to have some permanence so they can learn. But this is a pretty high-level overview. You've gotten more detail today on all of our key initiatives, Tony bringing in context for our key initiatives. But let me walk you through what we have in our book here. So did everybody find their book? Y'all got it? Excellent, thank you. So the opening pages, that's what we call our opening inspirational message. That's essentially the video you just saw. The next page was the wonderful readings that were done at the beginning of our day. That is actually Tony's call to action. Let's get going on our new vision and mission. Let's get going on community health. That's what the folks were doing early this morning. They were reading Tony's message to our employees. So I think really a great thing. You can think about how you want to share that in your department meetings. And then when we go into, on the next pages, our mission and vision, and then our values, each one of them, there are words that we pull out, just as Tony did, that make it really easy to describe. And these are reinforced in that community video you saw, so you would be able to show that to your teams as well. And by the time you get to the back of the book, each of the key initiatives, very high-level overview. And really, that's quite a lot for employees to absorb, and you'll get details over time about each of the initiatives and all the tactics and which ones impact your departments and what we're doing. But this high level, if we can communicate this and people can understand and embrace this, we will have been victorious as a management team. So this is what we're shooting for, is sharing this information. So our mission, the pages with our mission, genuine difference, the communities we're serving, that we care about health and not just illness care. So this was written for them, but it's also a great prompt for you. Same thing with vision, values, and then the initiatives. So here's some of the elements that you can use. There's the employee video, of course. We have team exercises. They're in your packets, and as we move forward through the next months, I know HR and marketing will be working jointly on team exercises, but there's even some in your packets here to do with your teams at your next department or team meetings. We really hope you are able to touch every employee through meetings or individually with where we're headed. It's kind of an effort on the same level as when we rebranded. We need to touch every employee because as the community's chatting about this, we want our own employees to be able to explain it and articulate it. You'll get forms to request more information or more mission, vision, and value posters. I'll show you those in a minute. And then, of course, the community video you saw at the start of the earlier today. This is really important. A lot of the same information is going to be presented at the forums. God bless Tony for being willing to do this 2, 4, 6, 7 times around the organization, around the network. So please encourage your employees. I know you always encourage your employees, but it really is a new day, and it's important that we get people wrapped around the new direction we're headed, and you can really help by getting people to those forums. I know that we have our current purpose statement and our people, service, quality, stewardship, all of those things around in posters, etc. So we will have resources for you for reposting the new look and feel and the new messaging in your break areas and staff rooms, etc. Also in your book, we thought this was just good for you to have as a leader. On our website, under Facts and Figures, or under the media site, excuse me, there's a section called Facts and Figures, and it's a one-pager. It's got both sides. I'm just showing you one side here. But it was our attempt to describe ourselves in the new way we see ourselves. So you can see we talk about proudly not-for-profit, community benefit, On the other side is talking about continuum of care and wellness services for our community, and that we're about health and not just healthcare. So it's I think a good single overview for you as a leader to have, but it's also available on our website for download. If you want to share it with your teams, you're more than welcome to share that as well. Really, we want to make it fun and memorable. We'll try to provide you so many tools to do that, and it's really up to you, and we really are. This is the ask. The ask is that you engage and excite and help us spread this throughout our culture, throughout the network. So over the next few months, there'll be some internal sharing with you kind of as our tip of the spear. You guys are heading up that effort for us. And forums we've mentioned, and I'm going to tell you a little bit about some of the other communications. Okay, so employees needed their own look and feel, and we wanted a different vibe going on. And then there's kind of another look that we're doing for everything external. Our own physicians and employed physicians, medical staff, community things, all of those things kind of have this look of I guess that's the left side of the slide here. This beautiful, it's a watercolor by Carol Paulson, and we've got a lot of her work throughout the network already. She's an artist we've used for 6 or 7 years. Local lady, does the calligraphy on our new values. Really neat lady. The reason we mention these folks that helped us put these materials together is we're the only locally governed, not-for-profit healthcare network in Reno. Carson Tahoe is similar, so don't say in our region, but say in Reno, we are, and that's really important for a lot of reasons, and it's important that we use local talent, and we do that wherever we can. And anyway, that's the beautiful images you'll see are from Carol. So what we're sharing, we've got communications planned for all sorts of different audiences. Our goals are really to instill confidence that we have a vision that will allow us to thrive, and that we're going to be transparent and even more engaged in our community. So those would be external messages. The community will be very excited and energized about our additional involvement, and so I think that's a really positive message. We'll be chatting with the media. We have Tony going to see the RGJ editorial board next week, so hopefully you'll see some media. KNPB is another interview that we have lined up for Tony. So anyway, you'll be starting to see this, so we really want you to understand it, so as your friends and neighbors and family members are asking you about it, that you can kind of explain where we're headed. So do most of you feel like you have a sense that you could answer some basic questions about our new direction? Yes? Excellent. Excellent. Donors, businesses, health partners, elected and public officials, kind of all these different audiences. We also, how many of you remember Take 10, Tell 10 from when we rebranded? Take 10, Tell 10, yay, some of you there. We gave you little leave behind cards, and there's a sample of those in your packets, or maybe is there even 10 in the packets, or we'll get you 10 if not. These are leave behinds. These are by no means a full explanation of where we're headed, but they're just enough information that you can leave them behind as you're chatting with people. So we hope you'll keep them with you. Maybe ladies, you can stick them in your purse, and gentlemen in your pocket, and just have them and help us spread the word. It's important that people understand our new direction. Okay, so physicians, there's a little bit different messaging with physicians. Not that everything we've shared with you today isn't completely appropriate to share, but they're also wondering about where they fit in this new world. And so there's lots of efforts specifically around reaching out to physicians. One of our key messages with physicians is letting them know that whatever kind, I think Tony will correct me if I say it wrong, but I think what Tony says is we don't care where your paycheck comes, Renown, your group practice, whatever. What we care about is who we're aligned with, and aligning with folks who put the patient at the center, who believe in the objectives of the triple aim, the same things that we're working on. And so there's room for the table at everybody, and that's a really important message for physicians. And I know a lot of you work with physicians, and so it's important that you understand some of the nuances of how we're communicating to physicians. And we put in a communication piece for physicians in your packet. It's mostly for information, but particularly for those of you that work with physicians, that you understand kind of the messaging to physicians. And it's a little more in-depth than I've just reviewed, but you have the one-pager in your toolkit. We'd like you to be clear on the messaging for physicians, as I said. Before I go to the next slide, are there any questions or something that seems obvious and that's missing from what you could use to talk to your employees about our new strategic direction? Do you have any questions at all, or are you missing something that would be helpful? Yes. Which pages are you holding up?
So the 3 pages that talk about our statistics, the one for the physicians and the key initiatives, because I run medical staff services, I'd love to have a packet of these.
We can get you as many as you need, and
Okay.
we'll get you a starter supply. That's easy to do. We can just print them really even in marketing, and we'll deliver some to you. And then, like I said, the facts and figures is on the website.
Okay.
And yes, we can absolutely get that done for you.
Okay. And is there any opposition to me putting them in the orientation packets for new physicians? Would that be
Absolutely
fine?
not. Absolutely not. Spread
Okay.
the word.
Great. Thank you.
Other questions? Yes, over here.
I just was curious, right now we recognize our employees based off of quality or stewardship, things like that. Are we now going to be recognizing them based off of the values that they're sharing with?
We are, and I'll ask Michelle if she wants to add anything else. They're kind of working, and there's an FAQ in your leader packet, because we thought there'd be some questions about the many things we do. Employee recognition is just one of them, that kind of follow the old, either the fundamentals or some of our previous approaches we were taking. So we are working on that, and yes, our awards will be, you'll submit an employee of the month under caring, collaboration, compassion. Michelle, are you somewhere that you want to add anything?
Maybe it's not on. Oh, there we go. Sorry. Just to echo what Phyllis said, the frequently asked questions document, we tried to take a stab at a lot of these different questions that we knew you would have, because as Tony mentioned earlier, we had done so much work around embedding the purpose and the fundamentals into much of our work that it really is going to be an opportunity for us to kind of unwind some of that. So we took a stab at that work. A lot of the things that you already did in some of the rooms today, we're going to collaborate on to help build those recognition programs, and we'll continue to do work in the HRLDs that are coming up to make sure we have your feedback related to recognition and what's meaningful for your teams. But the thought really is to help put everything under these 4 values as we go forward.
Okay, so now while I have you all gathered, I had one unrelated item to close out my section, and then we're going to ask Tony to come back up on stage, and he's going to address some of your questions from before and wrap up our day for us. Who recognizes this button? Hopefully you recognize this button. So about 10 days ago, we told you about a really awesome honor for Tony, and that is that he was put on a short list of the most influential physicians in the nation. It's Modern Healthcare that is trying to identify the 50 most influential physicians. They narrowed it down based on an application to 150, and the list is a who's who among physicians nationwide. So it's just an honor for Tony to have been put on that list. We sent out a reminder to all of you to notice basically that Tony had made this list and to please vote. And it takes literally 10 seconds to vote. You click in, you find his name, it's in alpha order. Slonim is an S. It's in alpha order, it takes literally moments. So if you have not done that, we'll be sending around another reminder. So please take a moment to do that, and we'll put this little image on it so it's a reminder that that's a vote for Tony for the most influential physicians. What a great honor that would be to have our CEO honored nationally, and it really is just an honor to have him on this short list, and he is the only Nevada-based physician executive that's on this short list. So without further ado, I'm going to bring him up here to wrap up the day for us. Tony?
Thank you, Phyllis. How you guys doing? Long morning? Good. We're more excited than this morning. That's awesome. So first, a couple of thank yous. An amazing team of people got together to make sure that this went off the way it was supposed to go off. And so my thanks to the HR team, the OD team, and the marketing and public relations teams that kind of put all this together. Really, a round of applause for all you guys. A moment of appreciation for the great food that we had, right? Yeah. Thanks to the Peppermill. Love that. And so a most important thank you to all of you for being here today and really helping us to figure out how we can make this special for the people that we are about to serve. You know, writing a very exquisite plan is fun, yeah, right. And now the real work begins because we've got to deliver on it. Phyllis has got me engaged, I think, 24/7 for the next 6 months in rolling out the plan. So let me talk a little bit about timelines, and then we'll get to some of the questions. You know, so what happens next is always a good question. And here's the way we've planned it out. Between now and the start of the new fiscal year, we're going to be doing what's called implementation planning. We alluded to that a little bit before. So it's great. We got a new mission, new vision, new values, and we've got strategic pillars with, as I think it was Dawn who mentioned earlier before, 400 or 500 tactics underneath there. One of the questions that came up is, can we see the tactics? Yeah, if you want. It's really, really laborious. I mean, this is in an Excel spreadsheet that just goes on forever. And under each one of those pillars, there are 6, 7, 8, 9 really initiatives that drive tactical level implementations. I think the important part is as we get further along in the thinking and really solidify what that plan looks like over the next couple of months, that will be the place where we will engage you with specific knowledge around where it impacts your team and your department. The other things that we're doing over the next 4 or 5 months is what's called implementation planning. So there's a lot more work that has to go on. We're not done yet, right? We've got to make sure that we get the initiatives done. We've got to make sure we get the tactics organized. We've got metrics that have to go in place because, by the way, we're getting scored on how we do and how we perform and how we roll this out. We also have other major planning activities that have to feed into the strategic plan. So not surprisingly, things like information technology and technologies more generally are a very broad but important part of the plan. We can't execute on the plan without new and improved technologies, new and improved devices, new and improved clinical technologies to help execute on the way that we're delivering care. And that part is under development right now, will be plugged into the strategic plan. In addition, a much broader marketing plan, a much broader HR plan. You know, when we talked earlier about key relationships, there were many key relationships that we hit on, and again, one of the most important is our employees. We want to make sure that we're helping our team, all of you and your team's teams, to be thinking about what are the skill sets we need to improve to execute on the plan, right? If we've been trained in a traditional model where we're thinking about one patient, one bed space at a time, we may not know how to think about population health, a very public health frame of the world. So thinking together about where we are as an employed group and how we move forward that work is part of what the planning is. And you heard a little bit about that from Michelle, right? How are we going to think about what skill sets we need? How are we driving leadership in the organization? How are we thinking together about our competencies as a leadership team? So all that is in process. We hope to get it finalized so that during the budget process, we can kick off with the strategic plan in mind. Now, I have my own view of this. It may differ a little bit from the finance people, but we'll go with that. She can't say anything. She's sitting over there. The way I think of this is we have to be thoughtful about the way that we drive day-to-day operations. And then we have to figure out what's really important to us. What's really important is being replicated here in the strategic plan. And we have to figure out how we fund that work. What are the skill sets we need? How are we doing that work? You can't continue with, as busy as we are, as busy as our people are caring for patients, layering on top more and more things. So I hope what you see in our rollout of the plan is that we're highly focused around 3 or 4 initiatives, that we're putting our money where our mouth is in terms of engaging in the right people to help us execute on the work, and we're going to do it in a stepwise fashion that doesn't burn any of us out, but allows us to do our work and at the same time live healthy lives for ourselves and our families. So let me go into, for a few moments, some of the comments and some of the comment cards that people handed in. First of all, let me compliment you all on filling out the cards. I have lots of cards, hundreds of cards. I went through them all. And yeah, I don't know if I should say this, but I'll give it to you anyway. So here's a Tony tidbit that you need to know, okay? So when the team asked me about, how I like to do my work and what I like to do, I said, well, have people ask a bunch of questions. Oh, people won't ask questions, right? So have them write them down. Okay, fine, we'll write them down. And then I'll take a break and I'll go organize them into some presentation that I will make up kind of on the fly. And they're like, really? You're going to do that? You're going to just go make it up? I'm like, yeah, pretty much. You got my notes here, but, So I was in high school on what they called varsity debate. Yes, there is such a thing. Varsity debate. I won't tell you about the varsity math team, but I will tell you about the varsity debate team. No, I'm not a geek, okay? And I was in the category, I always competed in the category, I did pretty well too, where they would hand you an index card with a hot topic, and you had 20 minutes, called extemporaneous category, and you had 20 minutes to come up with a speech of 8 to 10 minutes long. That was the most fun ever. And so now, I'm actually putting that skill to use. So here we go. Let's talk a little bit about some of the themes that you guys identified. And again, I'm really proud. We want an environment where there's openness, transparency, and the freedom to ask questions and seek answers. That's what's important about the new Renown. Nothing is off limits. I may not always have the answer, but we'll find it out, or we'll make it up. One of the two. What I heard loud and clear was an important conversation around the different populations that we were going to tackle. And so I compliment you on the fact that our team, our broad team here, is thinking about, can we shut some of those lights? That's really getting annoying. Can we lower them a little bit? Our team is thinking broadly about the multiple populations that we are going to take care of, right? I may have misspoke, I hope not, but some folks misinterpreted my focus on children as that's all we're doing. No, let's be clear. That's not all we're doing. It's an example of a way that we will help to move forward other population-based measures, right? And so lots of people asked, and good for you. You asked because you were concerned about the elderly. You asked because you were concerned about mental health in the community, which is a crisis, at crisis proportions. You asked about the and the underinsured, and the homeless, and low income, and how that makes a difference. And all of those populations are part of the conversation, but again, if we take on too much, we won't get anything done, right? We got to focus, we got to kind of pace ourselves to make sure that we're able to deliver good outcomes in a systematic way with our partners and engaging them over the course of time. So good news for you guys, you identified all of the many of the important populations, not all of them, but and they're focal points for all of us as we continue to figure out where we're going to put emphasis and in what order. And as a part of that, there's also disease states. So some people say, well, what about COPD patients? What about cardiac patients? What about, yeah, I get it, they're all there. How are we going to manage them is a little bit about how our conversation will evolve over time. Can't do everything all at once. Additional conversation as well around partners. Who might our partners be? So one question that came up was the VA. And well, what about the VA? By the way, VA's got their own problems at the moment. And P.S., we've offered to help. I met with the VA leadership here in Reno, 3-4 months ago, and said, by the way, you guys seem like you're going through this little problem. We're happy to help with the backlog of patients, and how can we make sure that patients get appointments appropriately and get timely access to care? And that's what you do when you're a partner in the same community. And they said, we got this. Okay, not what I'm seeing on the news, but that's a different story. So the VA is a potential partner moving forward, but the important part of partnership is you got to meet people where they are. Some people don't want a partner. If they don't want a partner, it's fine. We'll go on and find other partners. Many of you appropriately pointed out our rural partners. We have a very focused effort. That issue around population health on pillar number 1 is all about the region. We don't look at ourselves as Reno only. It's about Reno and Sparks and the rural partners and everybody else, okay? So thinking together, very legitimate point to bring up the rurals as an important piece of that work. And then again, around our other services, I gave some examples of things that we might do, really with a focus on the non-acute stuff. What are we doing around subacute? What are we doing around rehab? What are we doing around non-acute care hospital services? Some folks brought up some good ideas around group homes, mobile health clinics, other examples of non-hospital-based services that we may want to investigate. And that's what we need. We need everybody on the team thinking clearly about, hey, here's an idea. What do you think? Maybe, yes, no, don't know. If nobody brings it up, we don't think about it. So really thank you and appreciate that. I want to spend a moment of time talking about employees. We spent some time on this before, but I want to say probably 10% of the comments came about employee relations. And I think it's worthy of a moment or two. So A, thank you for thinking about it, right? As leaders, we represent broad constituencies of employees, and it's our responsibility to make sure that we're advocating and talking on their behalf. So let me give you some examples of the kinds of things that came up in that conversation, or in the questions and comments. So if we're going to live this healthy lifestyle, well, what about health and wellness programs for employees? What about gyms? What about evolving beyond the Healthy Tracks program? Get that front and center, got to figure out what that looks like, trying to figure out how we advance the conversation and make sure that those things are there. Now, we've got challenges in that realm, right? Because I said earlier, we don't want to be, although we've been challenged by the board about building a big campus, we're not supposed to be building a big campus. We're in and of the community, right? So if I build a gym on the regional campus, that helps the people who work at regional, but it doesn't help the people who are not at regional. So we have to think about, that's why that point number 3 that Larry talked about, network development is so important. A geographically distributed group of clinical services, a wellness and prevention network, but for one example, is a network service that we can access no matter where we live or where we happen to work. Those kinds of things are important for us as we continue to do our thinking. I don't have the answer yet, okay? But we're working on it. Additional conversations that came up, good conversation, really good questions. And again, I applaud you for bringing them up because sometimes they're difficult. We can't, right? I have a dear colleague of mine named Kathy. Kathy used to say, if you're a little bit uncomfortable, it means you're getting to the right conversation, right? So the conversations around, wow, with all this growth that we commented on, with all the things that are going on in the region, how are we going to remain competitive as an employer? How do we make sure our salaries and our benefits packages and, yeah, Tony, that's a really inspirational talk you gave this morning. But at the end of the day, I got to pay my bills and meet my family's needs. And it's not only me, I'm talking as a leader here. It's my team who I worry about and making sure that they can actualize what they have. And again, as I shared with you a little vignette this morning, as a CEO, this is one of the 2 things that I actually spend nights thinking about, unfortunately. And this stuff keeps me up at night. And we have to think together about what that looks like. We have to make sure we're competitive. We have to make sure we're the right place to work. We have a whole series of tactics around what it means to be employer of choice, and we continue to develop them as time goes on because our employees are our most valuable resource, simply stated. And we have to make sure we're doing what it means to remain competitive, make sure that they feel good about how we feel about them, and in part that comes through salary and benefits and other things that we provide. So front and center on our list, don't have a lot of answers at the moment. You'll see more as we continue to roll it out over the course of the year. 2 other issues around employees came up, around the issues for how are we going to recruit effectively for the kinds of things that we're talking about, right? This sounds like a really big bolus of work. Do we have enough people and do we have the right skill sets to do that? And in fact, a couple of comments related to, well, what does the team look like more broadly, right? So I shared with you at the very highest levels the executive team, and some comments reflected back to me are we only recruiting from outside the region? No, we recruit for talent. And so we recruit for things where we have opportunities to make sure that we're putting the right people on the team in the right seat to get the job done. That's what we're doing. And I'm highly consistent about that, and if we have the right talent here at Renown, I'm perfectly happy. Actually, the senior management team has had 2 people, 25 executives on the team. I think we've had 3 people recruited from outside. Everybody else is an internal move or repositioning. So really important. We're about outcomes, we're about delivery, and we have to continue to think about, but not be naive, that if we don't have a skill set, if we don't have an opportunity, we're going to go get it, right? We've got to think about that as well as we move forward. I think that was it on the employee piece. A couple of refresher points around volume to value, right? How do we do it was one question. Good question. Wish I knew. We'll figure it out, right? It's about, by the way, again, the point of strategic planning is you don't have to have all the answers. You got to have a direction. You got to know where you're going. The person that gets there first, they call them a leader, right? Because everybody follows them. That's what happens. And so we want to get there first, even if it means we're going a little bit like that to get there, because other people are going to follow, okay? Really important conversation for us. In this conversation where we're working both volume and value, thinking together about, several people asked, and I'll say it again because it's worthy of repetition. Well, what do you think about our competition? Well, again, I don't care. I mean, I really don't. I come to work every day, and I encourage all of you to come to work every day to do the very best job we can for the people at the center of our universe, the patient and the family. Everything else doesn't matter, okay? We've got to think together about how we provide that care for every person that we come across. And if it's team members, how are we supporting each other, and how are we advancing this conversation that we call leadership? And that really is kind of where I want to sum up. There's going to be a lot of questions were asked around technology. God help us, right? Technology, technology, technology. We want to make sure we've got the best technology to help us. Technology is just a tool, a series of tools that help us do a better job for caring for patients. Whether they're my laptop, which helps me analyze data and look at the way that we're organized, or whether it's a new CT scanner that has precision built into it that allows patients to get the best diagnostic care. Technology is really important. We want to be on the leading edge of advancing technological improvements in the way that we deliver care, like we have for many, many years. We're also going to be engaging in new technologies and software. So a question came up, an appropriate question. How are we thinking differently about the business enterprise? What about business intelligence software? What about sharing data so that leaders, managers, supervisors can make better informed decisions with the use of data? Right? How do we take this great thing that we got called Epic and actually get stuff out of it to help us inform our decision making in a way that is different and progressive and cutting edge? And so I want to just put a box around technology. Good news for me, we got a new member of the team called Ron. He's a Jersey boy, by the way. Ron got this. Where's Ron? There he is. Team got it. We're looking forward to it. The other thing that's really important as we go through this work, really important, and it's where we'll end today, is that leadership matters. It really does. You guys are the leaders at Renown Health. Leadership has a series of competencies that's associated with it. We're going to do lots of teaching and education about how we can be the best damn leadership team in the country, okay? Because I know we can get there. We each have an important part of being a leader is self-reflecting and understanding what your gaps and your opportunities are and what your strengths are so you can more fully contribute at the table with other disciplines. I had this amazing mentor many years ago by the name of Nellie. Nellie was a chief nurse executive. And she said to me, you know, Tony, the most important thing you could do as a healthcare leader is to make sure that when you're working with physicians, I was a medical director at the time, when you're working with physicians over here, your job is to prep them so that when they come to the table with other disciplines, they're prepared to not act like doctors. Really important, right? Because teamwork and participation and being in that game is very different from the way that we've been enculturated in whatever discipline we might have been organized for. And so we've got to come together as a team in order to make that happen. And we've got important changes that we have to make around advancing the conversation of culture. Culture is hard. This is tough. Change is difficult for people. I'm sorry. That's why they call us leaders. Suck it up. Here we go. That's my jersey coming out, Ron. here's what matters, you guys, and this, I want to end on this point because it's really, really important. When you talk about culture change and you talk about the job that we now have in front of us, which is taking this series of documents and making this strategy reality, we have a conversation that has to go on about how we rise to a broader understanding about what we are at Renown Health and what we represent. And we certainly all have our identity within certain areas of the organization. I'm an employee at Regional. I'm a medical group physician. What am I doing? I'm at Ryland. What am I? I don't know. But what do we do and how do we operationalize this work is really, really important. This team, all of you, right, need to be advocating on behalf of the people that you lead and at the same time have an important mission to Renown Health, okay? Really important. And so for so much of the comments and the questions and the reflection that came out in the comment cards was about, well, in my area, what are you doing for me? Okay, well, good, I'm going to go over here. What are you going to do for us over here? We, as leaders, have an obligation to make sure that we're focused at the Renown Health level and making sure that we're completing our vision and our mission for the organization. That's why I put a senior management team in, because that senior management team will focus at the level of Renown Health. We all have our identity at a different level, but across the 4 operating divisions, that's how we're going to organize our work, as we make sure that we're doing the best that we can for the communities and the people that we serve. Notice I didn't say patients. For the communities and the people that we serve. Okay? It's a different way of thinking. But when we get there, that's when we become renowned. Thank you all for your attention, and we appreciate your time today. Enjoy the rest of the afternoon.
All right, before you leave, just a quick reminder, please don't forget to pick up your bags on your way out. I think they're organized by alphabetic order so you can get in the correct line. But thank you so much for your time and attention today, and we'll be sending out a survey as soon as possible and get all of your feedback. Stacy. Oh, yes, there are pens in the middle. If you guys haven't figured out, there are pens that look like markers in the middle of your table. Those are actually chalk pens. You do have to prime them a little bit before they work on your chalkboards, but please take one. Those are for you to go with your chalkboards. Thank you very much.